All right, good afternoon, everyone, and welcome to tonight's webinar, our Confident Calving series. My name's Jack, and I'm the project officer here at StockSense. So I'll give you a little bit about StockSense. So it's a project run by the Victorian Farmers Federation. We're funded by the Cattle Compensation Fund and the Sheep and Goat Compensation Fund, and proudly delivered by the VFF Livestock Group. So, StockSense was established to help Victorian livestock producers maintain and improve animal health, welfare, as well as Victoria's overall biosecurity status. So, we do this through numerous ways. We run educational workshops, webinars like this one tonight. We develop fact sheets, and we have a monthly newsletter. And on our website, we got quite a lot of fact sheets. A few upcoming workshops. So we have one on July 10th in Eltham. It's about lambing, so come along to that one. It's pretty, yeah, peri-urban for that. Gisborne, so we have a hobby farm essentials on the 31st of July, and choosing the right goat webinar series on the 29th and 30th of July. So tonight we will run for an hour and a half. So I'll get through a bit of housekeeping soon. But yeah, lucky enough to have Rob Bonanno. So tonight will be on carving foundations and preparations, and then a little bit of Q&A. And then tomorrow with the same Zoom link, part two will be a bit more about interventions and problem solving. So I'll give you a quick description about Rob. So Rob is a former dairy farmer, a qualified vet with over 30 years experience in the industry, and he's actually been to China and United States and has run many education workshops in the dairy industry. So that's a little bit about Rob. So tonight we'll have Q&A at the end. So just type your questions in the box. They're anonymous. So yeah, I won't read your name out or anything like that. So yeah, as we go along, just type them into the box. These slides will be sent out at the end of the workshop. So you don't have to quickly scribble down everything. I'll send them out. So and a link to the recording will be uploaded on YouTube as well. Also, I'll get a QR code up the end. It's just a survey to keep these going. It would be great if you could just fill that in at the end, and it just helps us be able to keep running this. So, yeah. That's just multiple ways you can stay in touch. Yeah, we've got a website. We have Instagram, Facebook, and YouTube. And quickly, there's a few other projects the VFS runs. So we have MOFs making our farms safer. They do like farm safety visits, and we have a farm business support. So they look up grants, and yeah, if you want to get in touch with any of them, there's a contacts and also a little bit about a VFF member. So I'll stop sharing and I'll pass over to Rob, and yeah, we'll get kicked into it. So thank you everyone for coming.
Well, yeah, I'll share my screen and we'll go from there. Hopefully that comes up nice and clearly for everyone.
Yep,
Yeah,
beautiful.
beautiful. Okay. So look, it is a real pleasure to be here, tonight in the webinar. It's I'd always rather deliver things face to face. I think you get a lot more out of talking people face to face. But at the same time, there's the great thing about webinars is we can record them and they do become a resource that people can refer to later on. So yeah, thanks very much for the introduction, Jack. I really do appreciate that, and we'll kick straight into it. So when we talk about the carving essentials, realistically, I think that there's a couple of parts of it that I look at. I look at the sort of the management prior to calving, because the way we manage and handle our cows from essentially their own conception all the way to the point where they deliver the calf will affect the viability of the calf that they deliver. And then right around that point of calving, the supervision and the timely assistance that we provide is often required to save lives. And I do think that's a really valuable part of it. So just as a bit of a brief overview, we're going to talk a bit about preparing for calving. We'll talk a little bit about the stages of labour, how we might prevent dystocia or calving problems, and then what we might do to help with dystocia or calving problems. And I'll talk about the 20-minute rule. And I really like this concept of a 20-minute rule. We'll get into it deeper as we go along. But it's basically if you're making no progress or the cow's making no progress after 20 minutes, that's when you need to consider what you're going to do next. And then we'll briefly touch on the care of the newborn calf. So when we talk about the preparing a cow for calving. We're assuming the cow is pregnant. We've got all that, sort of sorted. We've got the herd nutrition right. That's so the cows are in the ideal body condition to calve. We need those cows to have enough condition to be able to be strong and robust, but not so fat that they're fat, lazy, and metabolically challenged. But at the same time, we don't want them really thin and weak. And if you've got cows that are on really low quality pasture or really low quality feed and are losing body condition right at that critical time around calving, that does some terrible things for their metabolism that will impact on their well-being and their ability to calve successfully now, but it will also have really significant impacts on their ability to conceive and calve again next year. The other thing that I think is important that we get right from the start is understanding that pregnancy and mating records are a really valuable tool when we start talking about calving problems and calving assistance and all that kind of stuff. Because if we know when a cow is due to calve, because we've got good mating records and or accurate early pregnancy testing, we can create these due to calve lists so that we know when a cow is due to calve. Because it's that 2 to 3 weeks either side of calving where a cow is at a greatest risk in her life. And if we work out which cows or heifers we're going to start managing for their transition, whether that be feeding them separately or not, whether we're going to move them to a closer paddock or a paddock where we can provide more supervision. I do think that without that early pregnancy test and or quality mating records, whether that be AI dates or observed services, without that data, it just makes your job so much harder to get your calving management right. And look, as vets, we often, turn up in our fire engines, we come out and we fix problems when they occur, but we would much, much rather be involved with people. And part of the business that I'm involved with in APM in our Pro Dairy program, it's about trying to be proactive and prevent problems rather than react to them. And so asking your vet to help you to work out a calving management program that's going to be appropriate for your herd size, your like infrastructure that you have on the farm, because there's no one size fits all. Because I work with farms that range from the most basic of equipment all the way through to really sophisticated barn setups where they're milking cows 24/7 and they've got trained maternity staff working around the clock. Now clearly that's not for everybody, but that's the spectrum of what we can work with. And often little small tweaks to your management can make really significant improvements. And then I suppose last but not least, if we're talking about the nutrition of the herd, we need to make sure that if we are going to be supplementing the cows in that critical transition period, we need to make sure that we've got all of our, we call it low DCAD or low potassium hay ordered up in advance so that we're going to prevent metabolic disease. We need to make sure that that hay is palatable, stored well so that it's not moldy or full of mycotoxins. And we need to make sure that we've got that feed available around that point of calving, because the biggest tragedy is if you run out of feed right at that critical transition period, and if you find yourselves in a feed pinch where you've got low availability of pasture, wet, muddy conditions, whatever the situation might be that causes you to have no good quality forages available, that is compounded because of the fact that transition period around calving is so critical. I think that the other thing that I encourage people to do at sort of this time of year, if you're preparing, getting yourself sort of starting to get organised for an upcoming spring calving or recovering from a busy autumn calving, is you need to restock your calving kit. And as Jack said, you don't have to copy this down because you can send it out. But this is a list of what I think is what people should have in their calving kit. I think that you need to have at least one long chain or a long rope. Particularly, I like a soft rope that you can use as a head snare, and we'll touch on that a little bit later. 2 shorter chains that you can use for leg chains. Often you'll find most of the vets that you will work with will use chains because they're very easy to disinfect between cows and between farms. But a lot of the times on farm, if people are using their own equipment, they'll use calving straps, which are broad little flat straps that you can use on the feet. And I really like those. But I don't use them in my clinical practice because of the fact that they're quite difficult to disinfect between farms. And so I prefer to use chains because of that ease of keeping them clean. They don't get wet and smelly in the back of my car. And so I do prefer chains for that reason. But if I was farm based, I probably would also seriously consider getting some calving straps. A calf pulley or a calf jack, um, people say, which do you prefer? And I say, well, again, it's horses for courses. A good calving jack, and I particularly like the Vink calf pullers, VINK calf pullers. Um, they're a really good design. They're strong and robust. Again, I don't carry one in my car because they're big and they're clumsy and they're awkward to carry around. But when I'm farm based, absolutely I use a Vink calf puller. In my vehicle, I carry a calving pulley, which is a really, really light, simple, multi-purpose. I use it for feet, for picking up feet from lame cows. I use it for putting hips back in if they're dislocated. I've even used it to pull my lawnmower out of a bog. Like you can use those calving pulleys for lots of things. And the one that I use has got some sailing pulleys, and it's got a cleat that you can pull the weight or the strain up on it and then lock it in, and it will hold. And then you just flick it to release it, and it's a very, very easy and efficient way to apply traction to a calf. The nice thing about the calving pulleys is they get a 3-to-1 or a 4-to-1 advantage, and so even a 59-year-old weak bugger, 58-year-old weak bugger like me can still get a fair bit of pull on a calf, and pull without getting outrageous amount of pull on the calf. And so I do think a good calving pulley is worth its weight in gold. Obstetric gloves and lube are important, not the least of which is that if you put gloves on, it helps to keep things clean, but it also helps to provide you with a barrier that can protect you from some of the zoonotic diseases that potentially could be spread when you're assisting with a calf. By zoonotic diseases, I mean diseases that the animal has that they can spread to you as people. And things like leptospirosis, there's neospora, there's a few other different things that you can spread that you probably want to be a bit careful. Q fever is another one. For what it's worth, if you're working with assisting cows calving, ewes lambing, goats kidding, if you're assisting with any of those things, it's a really good piece of advice, and I highly recommend that you go out, speak to your general practitioner, and identify whether they or somebody they can refer you to is able to do that Q fever vaccine, because it is an incredibly valuable prevention strategy for us catching Q fever. And while for most people it's nothing more than a severe flu, for some people that get Q fever, they'll be debilitated for a long, long time and feel very unwell. Calf resuscitators, again, I'm near 6 of one, half a dozen the other. I've seen them used well. I've seen them used poorly. They're a nice idea. Often I just simply use towels, sit the calf up in the recovery position, give them a good scrub, and that will stimulate them to breathe. I like the idea of applying a tag to the calf as soon after birth as you can, whether that be a management tag or an NLIS tag or both. The idea being is we want to identify those animals and know, whether that calf belongs to that cow and keep those good records. And so, having a good permanent marker pen is part of that if you're putting tags in. Coats for weather, really wet weather, really cold weather. If you can, get the calf cleaned up and then, dried and then put a coat on it, by giving them those reflective coats that sort of basically keep their body heat in, you reduce the amount of energy that the calf's, I won't say wasting, but using to maintain its body temperature. And that's really important thing that helps the viability of those calves, especially if they're born on a freezing cold July or August morning. The wind's howling, it's been raining. If you can put a coat on them, that can make a world of difference, and it can literally mean the difference between life and death. So having a few calf coats in your calving kit, I think, is a really, really good part of your equipment. And last but not least, we say navel spray, but you can use dips, you can use navel clamps, but like normally we would recommend 2 to 4% chlorhexidine, 7 to 10% iodine. Often I'll mix those in methylated spirit. That's mixed 30% water, distilled water with 70% metho, just to create a nice drying effect on that navel. Because if you dry that navel out and disinfect it, much less risk of bacteria getting in through the navel, causing infections in the navel, but also causing infections in the joints. We talk also about keeping a sick calf kit. I really like every farm to have an easily accessible sick calf kit, so you're not scratching around looking everywhere for bits and pieces and all that sort of stuff. If you've got some disposable gloves and a waterproof apron, maybe some waterproof, gear, something that you can disinfect your feeding equipment if you're going to use tubes or teats to feed colostrum or to feed sick calves, and having those tubes or feeders designated for sick calves, and especially, and I say this with our dairy farmers in mind, if you're having calves that are getting sold for slaughter as bobby calves, it's absolutely critical that you don't use the same feeders with medications in them on those bobby calves. So if you've got sick calves that you're adding anything to that milk as a supplement that's got a milk withholding or a meat withholding period on it, it's really important that you don't cross-contaminate, because even really tiny amounts of residue in the feeder can be enough to make a calf test positive. I think every farm should have a source of a good electrolyte, and in my perfect world, that electrolyte would be what I call a zero bicarb electrolyte, because there's kind of two types of electrolytes. There's ones with bicarbonate of soda, and there's ones without that have got usually acetate or lactate in them as their alkalizing agent. And the reason why that's relevant is because when a calf is really sick and has scours, they will become quite acidotic. We need to reverse that acidosis. But if we're using an electrolyte that's formulated on bicarbonate, they're often much cheaper because the bicarb electrolytes are cheap. But the problem with them is they alkalinize the gut as well as the blood. And so that can allow bugs to sort of survive. Instead of being killed by the acid in the stomach, those bugs can survive and get into the intestines and multiply. But the other thing that the bicarb electrolytes do, and especially this is relevant for our beef calves that are suckling from their mum, hopefully because they're feeling better enough, well enough that they get up and suckle. But if we've given them electrolytes with bicarbonate in it, that can actually stop the stomach acid from being strong enough to clot that milk and create that sort of curd and whey effect that we want to happen in the stomach, so that the curd is digested slowly and the liquids are sort of passed through more quickly into the intestines. So if you're going to use electrolytes, I would encourage people to use a zero bicarb, but unless you're using lots, buy the smallest bucket you can buy, because the huge disadvantage of the zero bicarb electrolytes is that they attract moisture. And so if you leave the lid off them, you come back to a big blob of brown goo. And if you've paid $40 or $50 for a 4 kilo pail of electrolytes, and you leave the lid off after one use, and you end up with just a 4 kilo blob of brown goo, that's an expensive mistake. And so please don't do that. I said earlier about sick calf coats. I really highly rate them and recommend them. I think that every farm should have a thermometer on the farm that you can use, a rectal thermometer, so you can stick it in and see whether they've got a temperature or not. Recognizing that on a normal day, 38.5 to 39.2 would be sort of the upper limit of what we consider normal. And so if you've got a calf that's temperatures over sort of 39.5 to 40, that is a fever and warrants treatment. I think that you need to have some sample pots, so that if you've got a calf with scours, you can collect the sample to bring it into the vets and we can test it. And also having new syringes and new needles for your calf treatment. So I think is a great idea. Like the number of times I go to farms and I see people using syringes that the numbers are nearly worn off, and needles that are so blunt that you nearly need to hammer them in through the skin. It's ridiculous. Please don't do that. The needles and syringes are relatively cheap in the big scheme of things. please use new ones. If you're going to put your calves into a shed, the ideal scenario is that the calves come into a clean shed, they come in as a group and they leave as a group. That's the perfect scenario. For smaller herds and for year-round calving herds and people that are rearing calves all the time, that might not always be easy. And so then removing used manure between groups of calves and disinfecting and cleaning, using hot water to scrub, getting as much of the organic matter, basically the poo, off. And you can use a pressure washer. I don't recommend that if there's other calves in the shed because it creates aerosols. But nothing disinfects a calf shed better than time and sunlight. And so, you can put lime and magic foo-foo dust and you can spray all sorts of stuff in there. But ultimately, if you've got a calf shed and it's rested and cleaned after the calves come out and rested, that's as good as anything. Put fresh bedding in, use an improved disinfectant on floors and surfaces. And if you're going to use the shed over and over through a calving season, making sure you've got enough bedding in at the start and put aside so that you can top it up and put fresh bedding if it becomes wet or becomes too soiled is a really good idea. Don't have leaking troughs into your calf pens. That's a recipe for disaster. They'll get coccidiosis. And if you're going to use an isolation pen, please make sure that your isolation pen is up to standard. There's no point sending a sick calf, I call it purgatory. You've taken them from a pen and you've put them somewhere where they're in a terrible, breezy, cold, wet environment to isolate them, but you've almost essentially ensured that they won't make it. So your isolation pen or pens need to be clean and they need to follow the same protocols. The calving environment that your cows calve in is also incredibly important. On our dairy farms, they often end up calving in calving paddocks or on calving pads, sometimes now even in calving sheds. Now, they are great because they help us to sort of control the environment and control the movement of the animals, and we can feed them well and all that sort of stuff. But if they become really wet or dirty, they can become just a recipe for disaster because that calf is born into a very dirty environment. And so that means that they get a really bad start. They get lots of bugs. And before they're even getting colostrum for immunity, they've already got, a serious dose of bugs. So again, it comes down to what I was saying earlier about having good calving records and good mating records. Because if you know how many cows are going to calve when, you can determine whether you've got enough space and enough feed, and you can also create your contingency plans around what you might do if your calving paddock becomes really wet and awful. So if you've got a calving paddock and you've got several that you can rotate through, that's kind of the ideal. So that when one area becomes wet or contaminated, you can shift to a clean environment so that the calves are given their best chance. The other thing that I also encourage people to do in a lead up to a calving is make sure that things like your crush has been serviced. If you're gonna bring cows into a system calving, having a headlock that doesn't shut, side gates that won't open, backing gates that don't close, and some of the filth that I see in and around calf crushes, cow crushes, where people are expected to deliver calves, and you pull the calves out and they're landing in knee deep just slop. Please, if you've got the time and the inclination, get in there and give your crush a good service, give the area around it a good cleanup in your preparation for calvings, because it's these preparations that actually make the most difference. People sort of think, oh no, I need to do this little trick or that little trick, but it's actually the work you put in the lead up to getting cows to the point of calving that pays the best rewards. I talk about vaccinations as part of calving because with our calves, when they're born with very, very low immunity. They have they have no antibody immunity and very low cell-mediated immunity. And so the colostrum that they get, that first milk that's produced, the very first feed of milk that they get in their first 12 to 24 hours, that will determine what antibodies they have to carry them for the first 4 to 6 weeks of their life to get them through until their own immune system starts to actually do some of the heavy lifting. So working with your vet, identify what the right vaccines might be for your herd. And if you're going to give a vaccine program, do it properly. Give the right timing, get the immunity right, get the vaccination boosters when they're required. And if you are introducing new animals to your herd, make sure that they're caught up with the primary vaccinations. I've seen this happen many times where people buy a group of heifers in, particularly, and they're going to carve them in, and they might have vaccinated their own herd with 7-in-1 and some scour vaccines and a few other bits and pieces. And then these new ones arrive, and the calves from those are really going to struggle, because if those mums aren't vaccinated against the bugs that are present on the farm, the mums have no or limited exposure to the bugs on the farm, so they produce no natural immunity to those bugs. And so then those new calves from the new cows, which are often ones that you've paid a lot of money for, or they might be, special genetics or whatever, they're the ones who struggle the worst. And so I encourage people to make sure their vaccine programs are, really sound. And order your vaccines well and truly in advance, because at the moment, with the way things are in the world, we're struggling at times to keep up the supply of various medications and vaccines. So we talked a little bit about the colostrum quality and vaccination, and it's basically this strategic vaccination of the mums to produce the antibodies that the calves pick up. It's interesting because people think that if they vaccinate the cows, they're going to get better quality colostrum. And if they're measuring it on a refractometer, they're going to say, oh, it's going to be higher because we vaccinated. But that's not necessarily true. It's actually that you get more specific immunity. So you'll still get similar quality colostrum, but it's supercharged by having specific antibodies to the diseases that may or may not be present, but often the ones that we know are present on the farm. And it may help, especially if you're treating. So there's some good scour vaccines that you can give to the cows to protect the calves. And we use them if you're getting about sort of 10% or more of calves with serious sickness of scours, or if you've lost 3%. And if you confirm things like salmonella or rotavirus on the farm, then we know that vaccinating for these things are really useful. And we use them really commonly on our dairy farms, but it's a little bit less common on our beef farms. And so we do worry that sometimes if you have an outbreak on a beef farm and there's no innate immunity and there's no vaccine immunity, the problems can really run through those herds. And it does rely on good vaccine records. So I talked about, protecting the calf by putting specific immunity, specific antibodies in the colostrum to give the calves immunity, but the calves must ingest enough of the colostrum. So if you don't get sort of probably ideally 10% of the calf's body weight of colostrum into it in the first 12 to 24 hours, you miss the opportunity to get those antibodies in. And after the calf's more than about 12 to 24 hours old, their ability to absorb the antibodies from the colostrum almost disappears after 24 hours. It's down to less than 5% by 24 hours. And so what we're trying to get people to do, if they're going to supplement with colostrum, they've either collected some and stored it, or they're actively feeding tested colostrum back to the calves. It's really critical that you do that, ideally in the first 12, but absolutely within the first 24 hours, because after that, you've really missed the boat. The opportunity is past. We have excess colostrum that so if you've got more than you need and you're feeding bucket colostrum, you can actually feed that just to give them some local antibodies in the gut, but they won't absorb the antibodies through the actual blood, the gut into the bloodstream. And it's this idea that we're giving colostral vaccines to the cow. We want to start, if you've never given them before, you need to start sort of about 10 weeks before the cow is going to calve, because we need to get an initial little primary response, but we don't get much benefit from that, really. It's the second vaccination that gives the strong secondary response that lifts them sort of well above the protective level at or around about the time where they start to produce the colostrum, which is about 4 to 5 weeks before they start to calve is when they start to make their colostrum. And so I think that that's really important, that we boost them so that their antibodies are at the highest right about the time they're starting to produce the colostrum. So that's a kind of a rule that I give people around vaccines is think about what you're trying to protect with the vaccine. If you're trying to protect the calf, you give it to the cow just pre-calving because you want to put those antibodies in the colostrum. If you're trying to protect a pregnancy, say, for example, with BVD vaccine, pestivirus vaccine, you want to do it just before you're going to make the cow so that you're going to make sure that your immunity is there when the new little conceptus, the new little fetus is there. You want to protect that. And if, for example, you were using something like 7-in-1 to protect yourself and your workers from lepto, or you're using botulism to protect the cows from getting, catching botulism from the feed, you just do that as an annual booster because it's no specific time that you want to use. I'm going to now move on and get more into the guts of it. What's happening as a cow is going into labour. And so the stages of labour, and talk a little bit to you about the signs of an impending calving, like it's going to happen. And we see some behavioural changes, and it's usually that the cow will become a little bit restless, the heifer will become a little bit, uneasy, and they'll often separate themselves away. You see them off from the mob. And that is nature's way of them just sort of simply isolating themselves, and that's a behavioural change. And the physical signs that we see is that they start to develop their udder. So we often call it bagging up. Their udder starts to fill. You'll see the softening and swelling of the vulva. The tail ligaments become soft and the tail becomes more floppy. And depending on the breed, some of them get to the point where they're really floppy and you think, gosh, like she must be going to calve any moment now. That is a really good way that we can see that the cow is about to start calving. Now that we're using some technology as well, things like collars and rumen boluses and stuff like that, we definitely also see reductions in rumen activity, changes in body temperature and stuff like that. But they're not often signs that we can see overtly. But if we're using technology, we're also, I would add that to the list now, technological signs that we can detect. When a cow goes into labour, there's actually 3 stages. And the first stage of labour is just basically the initiation of the process. The cow will separate herself from the herd. She'll start lifting her tail. She's going to swish her tail around. She might kick at her belly. She might get up and down. And, she's going to do, a few behavioural things like that. And then the last thing you'll see in stage 1 is usually the water bag. If you see that little sack hanging out, you know that she's on the job at that stage. And it should take somewhere around 3 to 6 hours, but it can take up to 12 hours. And so it's really challenging to determine whether a cow is progressing in stage 1 or whether she's stagnated. And normally I would say if there's no progress to stage 2 after, say, 6 hours, I would check them. Even in a heifer, where it can take longer and still be quite normal and quite natural, if you put your hand in this and you go and check them and you've got a feet and a nose and they're just sort of there and they're getting about the business, you can leave them be. But I would normally say if you've got no obvious problem but no progress after 6 hours, that would be about a good time to think about having a look at them. And here's a cow on a calving pad, who's clearly got the water bag showing, the placenta starting to show, and she's one that you're going to keep a close eye on, and you might not let the sun go down on her. The second stage of labour is actually the real labour. It's the bit where they do the pushing. Things are moving at this stage, and it should last 30 minutes, no more than probably 4 hours, even in a heifer. Once they actually start to push, and I normally would say probably not even 4 hours, I might almost get a little bit more excited at 2 hours. But the cervix by this stage is fully dilated. They're ready to deliver. The water bag's broken. You'll see some contractions, and the calf at this stage should enter the birth canal and exit the birth canal. If she's not out within sort of that 30 minutes to 4 hours, we're starting to get concerned. But slow progress is progress. And so what I mean by that is that if I'm watching a heifer or cow calving and she's sort of down and up and down, and then she strains a bit and the water bag breaks, and I can see tips of feet and a tip of the nose. And then 15 minutes later, there's sort of wrists and, nearly to the eyes. That's really good progress. She hasn't delivered in 20 or 30 minutes, but she's making progress. And if she's making gradual progress, I'm not going to get too worried, even if it's taking some considerable amount of time, especially as I say in my heifers. But if there's no progress, that is the difference. And so if I've had no progression after 2 hours, so if I've been looking at the tips of a nose and the tips of the feet for 2 hours, clearly that is not progressing, and that calf is in trouble. And I do need to, get her in and assist her, because we want it to progress and we want it to be natural. And every time we put our hands inside a cow to help her, we've almost guaranteed we've introduced infection. So if they can do it on their own, all the better for it. And if you get in there too early, before they're really fully dilated and ready to go, and you reef those out, you'll often do more damage than you do good. So it's finding that balance and being really, like, it takes skill. It really truly does take skill, because if you get in there and rip them out too early, you can you can be trauma, you can paralyze them, you can do a whole bunch of stuff. But like, here's what, this is basically the last stage of stage 2. This cow is on the brink of delivery. That calf, you can see, is alert and ready to be delivered. And probably not the ideal calving environment. When you look in the background, there's cows standing up to their chests in the water just about. But that's an example of a cow that's progressed right through her labour. The final stage of the labour is the expulsion of the membranes. We talk about retained placenta or retained fetal membranes, RFMs. That's if it's persisted beyond, say, 12 to 24 hours. Under 12 hours, it's quite normal. So if they've retained their placenta for more than 12 hours, we'd refer to that as retained fetal membranes. And those cows then need to be closely monitored to make sure that they don't get an infection and become unwell. The reason why I spent a bit of time on these normal stages of labour is because if we don't know what's normal, we can't recognise what's abnormal. And we're going to start going now and talking a little bit more about the prevention of the dystocia or the calving problems, what we can actually do. And here's an example. Dystocia is a really cool word. It means difficult birth. A lot of people just say, she's having problems calving. It's exactly the same thing. We like to give it fancy names to make us sound smart. Why does a cow have trouble calving? Like, the fundamental question that we're trying to address here tonight is why will a cow get dystocia? What is the underlying reasons why a cow will have dystocia? First and foremost, she's too fat. You see, she's in really high body condition score. She's got big pelvic, fat pads. She's big, fat, lazy cow that just doesn't have the push in her. The second reason would be that the calf is too big or the cow is too small. Sometimes both. But so that we call that a feto-pelvic disproportion. The fetus is bigger than the pelvis. And I had one of them the other night where I literally could not even get the toes and the nose through the pelvis. And when you get to that, you know that there's no way that calf's coming out except through the side. The other thing that will cause dystocia is if the cow has weak or absent contractions of the uterus. That could be because she's thin and weak. It could be because she has metabolic disease like milk fever or ketosis. But weak or absent uterine contractions will cause the calf to not progress. And so that's a cause of dystocia. Twisted uteruses. Every vet's worst nightmare, because, if they've got a uterine torsion, we've got to try and untwist that calf. And they're quite difficult to do without detorsion rods. And sometimes even with rods, they're quite difficult to untwist if they're twisted more than sort of 270 degrees. But a twisted uterus is where the calf is rotated inside the uterus. And so it means that the cervix can't open. The cervix might be open, but it's twisted and closed, and so they can't come out. And then probably last but not least, is an abnormal delivery position of the calf or calves. And we just call them malpresentations. That's where you've got a head twisted or a head down or a leg back and I've got a slide coming up where we'll go through a few of those. But I guess my question that I always ask myself and I ask people to think about is what of those reasons, body condition score, big calf, small cow, weak contraction, twisted uterus, abnormal position of the calf, which ones can we control? And I guess that the first three we can do something about, and the last two, nature decides what happens with those. And so we kind of are, limited what we can. They say control what you can control, and if we can control the body condition score, and we can control the size of the calf or the structure of the dam, and we can make sure that the cow's metabolically healthy so that she's got good strong uterus and good strong contractions. That's our controllables. We can control for more of the causes than we can't, but it does require some thought. It requires planning, and it requires like a bit of structure to your breeding program. So with our dystocias, body condition score, if a cow is very fat or very thin, she's got a high risk. Now, for our dairy cows, we use an 8-point score in Australia, and we aim for around 5.5, sort of somewhere between 4.5 and 5.5. And for our beef cows, it's 3 to 3.5. If you don't know what I mean by body condition score, that's one of the reasons why Google was invented, so we can look stuff like that up and just put it in. If you've got beef cattle, put in beef body condition score 5 points, whatever, and it will give you the pictures and the descriptions of what that is. And that's what you want to aim for. Alternatively, there are technology solutions. There's one thing called Cataly that can, set up and it can actually give you that. Or you can use an experienced person like a vet or a stock agent who's skilled at giving you body condition scoring to give you an idea where your transition or about to calve cows are. We know that very poorly conditioned cows, so really skinny ones, drought affected cattle that have had disease or something going wrong with them, they may just simply be too weak to calve. And we get a disease called pregnancy toxemia where they just go down and they're just too weak to calve and they're too weak to get up again. And those cows usually don't end up making it, and they often deliver a dead calf if they deliver a calf at all. And so you really need to make sure that if your calves are poorly conditioned, you need to do what you can to try and reverse that in time. And as I say, the very fat girls, they have the metabolic challenges, and they can have physical difficulty. I've actually seen cows that had such a big fat pad in their pelvic canal that we weren't able to deliver the calf because there was so much fat in the pelvis. So another thing we talked about is that the cow is too small, and that's most common in small, poorly grown heifers. But it can also be that the breed of cattle that you've got relative to the sire that you're using is not appropriate. And so in small, poorly grown heifers, we certainly see a lot of problems. And in my perfect world, I would have my heifers calve at around 90% of the mature body weight of my cows. So if my cows are 600 kilos, our heifers should be calving between 550 and 570 kilos. And if we're going to do that by 24 months old, that's a pretty big ask. We want them to calve as 2-year-olds because that's efficient and profitable and all that sort of stuff. But if we're only getting them to 450 kilos and we're worrying why we've got, 20% calving problems, my answer to that is duh. Like, we've got undergrown animals that we're trying to get, we've got calves having calves. It just doesn't work. The time, the money, the effort that you put into growing mature heifers that are at the ideal body weight, if you can get that right, you'll get much less problems with calving and a much more profitable herd. And I throw this challenge down to people. How many of your heifers are actually achieving this? For those of you who've got scales, are any of you putting your heifers on the scales and seeing whether they're hitting that sort of 90% of the mature cow body weight at calving? If they're not, there's still room for improvement for you. So our sire selection is incredibly important because if we have really big calves relative to the size of the cow or just really big calves in general, it will increase the risk of calving problems or dystocias. And that kind of makes sense. if you use the wrong breed of bull, or you use the wrong bull over your cows or heifers, you've got to expect more problems. And you can use things like short gestation bulls, low birth weight bulls. We call them calving ease bulls. And there's in the dairy game, there's a good bulls guide. Every single AI company has got tons of information on the calving ease breeding values of the bulls that are in their programs and their packages. And so I'll cover that a little bit more tomorrow, but we'll cover that off around what you can do around some selective genetic selection, breeding selections to try and reduce the risk of dystocia. The management and feeding of your cows at transition, sort of in that 3 weeks or 4 weeks either side of calving, is really, really important. In our dairy and dairy cross animals, so I still see milk fever in dairy cross first animals, like where people are using, say, Friesian, black and white baldy cows, Friesian Hereford cows, Friesian Angus cows as the mums of their beef calves. They will get milk fever if they're on really high potassium grasses and we're not managing their transition feeding well. There are really obvious lactation and metabolic benefits. If you get that transition feeding right, then not only will you reduce the likelihood of a cow getting calving problems, getting milk fever, but she's also more likely to get in calf next year. And because if they're mobilizing a ton of body condition at around calving, it sets their whole metabolism back and they struggle. And interestingly, this is where vets, nutritionists, consultants, we can help you with it. It really is something that we're able to work with farms to help to come up with a plan of how you're going to manage this risky period of the cow's life. We talked a little bit earlier about assisting with the dystocias, especially assuming those ones that we can't control, where the legs are back, the head's around, all this sort of stuff. And I briefly mentioned earlier the 20-minute rule. Here's a poster that we put out with our farms, and it sort of shows us up in the top corner a normal presentation. It really does show us what a normal backwards or posterior presentation, and then we've got all the weird things that happen in the world, and I've seen every combination of this and then some. Twisted ones. The ones that I really hate the worst are those transverse or back first presentations where there's just nothing to grab onto. There's no limbs. All you've got is the middle of their back. They're awful. Heads out, legs back, heads back, legs out. All these things, each one of them requires a different skill set to try and get them out. But basically, the first thing you've got to try and do is decide, when am I going to intervene? Because sometimes it's really obvious. You've got an obvious malpresentation. You've got, one leg out and nothing else, or just the head, that we call that the Superman, the calf is coming out with its head out, legs are back. You see that and you just know there's trouble. The other thing that you can sometimes see is evidence of distress, staining of them, around the backside of the cow with blood or feces, which she's really been strained, she's really distressed. But more often than not, it's subtle, and it's just because there's been no progression of the labour. She's either gone, nothing's happened in stage one, or she's actively pushing but getting nowhere after a couple of hours. And one of the things that I often say to people is, if you've got the front legs coming and the nose presenting like you expect that it should, like the calf's meant to dive out of the cow, but those legs are really crossed and you're getting nowhere, that's a pretty good sign that you might need to get in and give a hand. And I think that the key thing the point that I would make in this slide is that the intervention will just depends on the experience and the judgment of the stock person. And I encourage people to only intervene where the facilities permit the safe examination. I know plenty of people who've been injured trying to calve cows behind gates, chasing them around paddocks. You can get injured doing this. And trust me, I've done some pretty dumb things in my 35 years working as a vet. I've got the injuries and the broken bits to prove it. And so if you're not got safe facilities, or your facilities are not being well maintained, please get them right. I do like us to have a well-stocked calving box, as I said, so that we've got all our stuff together. We've got our good restraint. I like to have 2 buckets of water, a bit of a silk like that, one that I can be working out of, and another one that I can keep clean. And that hygiene is really important, because if we're putting dirt and manure inside the reproductive tract of the cow while we're going backwards and forwards in and out of that cow, we're not washing our hands, we're not washing and disinfecting the equipment that we're using from one cow to the next. We are setting those cows up to really struggle in that post calving period, because we're giving them infections, and we're almost guaranteeing that they're going to struggle. But essentially, what I do when I'm thinking about my basic principles of intervening is that I feel, first of all, I make sure the presentation is something that I think I can correct. If I've got it to the point where I've got 2 feet and a head, or 2 back feet extended coming, and I think, yep, I can pull this, I need to make my decision as to whether I can deliver this calf. And that comes down to assessing the size of the calf relative to the birth canal. And if the calf is coming forward, you can fit the hand over the head while it's in the pelvis of the cow, and you can pull both front feet at least a hand's width past the vulva when you're just pulling on the ropes. You don't necessarily got it on the jack. You're able to pull it and extend those feet out, sort of like a hand's width from the fetlock, a little bendy bit, out of the vulva. If you can do that, you can slide your hand down beside the head and extend the feet out to there. Almost always, I shouldn't say always, but almost always, I've got a pretty good feeling that I'm going to be able to deliver this calf coming forwards. If the calf's coming backwards, same story. I've got the legs extended, and I've pulled the back legs out, and the hocks, which is like the pointy bit of the back leg, is level with the vulva. So you can reach that point all the way out to the level of the vulva, the pointy bit of the back leg, and I've pulled it to there, and I can fit my hand over the pelvis of the calf, and I can feel that it's going to fit through the pelvis. I'm pretty comfortable knowing that I'm going to be able to pull that calf if it's coming backwards. If, as I say, there's one the other night that I had, literally I couldn't even pull the feet and the snout into the pelvis. And so there was no way that calf was coming out. And so I made a decision quite early that it was not going to happen, and that we were going to have to do a cesarean on that cow. Another key thing that I see people do wrong is where they're pulling on one front leg and one back leg. and it happens, and it's embarrassing for us when it does happen. But I've got a really easy way of determining whether you're pulling on a front leg or a back leg. The front leg has 2 bendy bits, whereas a back leg has only 1 bendy bit between the pointy bit. So a front leg has the fetlock and the sort of the knee before we get to the elbow, whereas the back leg only has the fetlock before we get to the hock. And so with our front leg, we've got 2 bendy bits, and they both bend in the same direction. And then we've got a pointy bit, which is the elbow. And so that's how we know it's a front leg. The back leg, we've got 1 bendy bit, and it bends the opposite way to the pointy bit, which is the hock, or the equivalent of our ankle. And so when you're pulling on a calf, when you're trying to put ropes on, you're trying to decide, you're trying to make that mental picture in your head, what is it here that I'm grabbing hold of? Do that. Find the hoof, bend it, go, yep, there's a flexi bit there. Oh, another flexi bit there, that's the knee. They both bend the same direction. Great, I'm on a front leg. And that way, so long as you're pulling on 2 front legs, ideally belonging to the same calf, then you're going to have a better chance of getting that calf out. Whereas, as I say, if you're pulling 1 front, 1 back leg, good luck trying to pull that out, because it won't come. If you're going to put calving chains on, I usually try and get them to loop over the top of the fetlock, and then do another half hitch below the fetlock, just above the hoof. And that double half hitch allows me to sort of align that leg and get a nice strong pull without running the risk of fracturing the limb. If you're using straps, it's not as critical to do the double loop or ropes, but I do like to do a double loop when I'm using chains if I can possibly get it on. Sometimes what I'll do is I'll just put a single loop on and pull the limb up and then put my second loop on before I put significant traction on it. Now, the reason why I do that is because working down inside the cow, you're trying to get that loop on and then trying to get it doubled over and is really quite fiddly and quite difficult. And as I said earlier, with my front feet, if I can't pull them out sort of at least a hand's length past that fetlock, I'm worried that I'm not going to be able to pull that calf out anyway. So if I can pull it up to there and then I've got the foot outside and I can just slip the second hitch over, makes it really easy. I like to use head snares or head ropes. You can buy fancy ones that come as like a little, I suppose, a little wire or a plastic loop that you can sort of slide up over the head and pull up. But I just often use a soft head snare or head rope. And the thing I like about it is it can keep the head coming in the right direction so that the calf doesn't pull the head back away from you as you're trying to pull on it. But it also allows us to pull the head independently of the legs. And sometimes, particularly cows with broken down tails where they've been ridden and the tail head's broken down, we need to pull that head ahead of the feet and then slide the feet out and then walk the calf out that way. And I do think for the really big calves, having the ability to straighten that neck out thins them down at the chest a little bit, because otherwise, as you pull them, if the head's sort of pushing back, it kind of kinks them up and they get sort of almost broader at the chest as you pull them with their head not coming. Whereas you pull that head forward and you straighten that calf out and you actually allow the calf to be delivered. And if you put it on like is in the picture here, where it sort of sits behind the ears and into the mouth, that actually, you can almost not do any damage doing that if you're using a soft rope. If you're putting ropes around the jaws, people use eye hooks. I'm not a massive fan of eye hooks, particularly in live calves. I think they're cruel. But if you can get a soft rope like this on, fantastic. Sometimes I'll put a rope snare just on the bottom jaw just to pull the head up enough that I can work with it. And I use the corner of the lip of the calf as a, sort of something I can hook my fingers in to sort of manipulate the head into a position that I can pull on it. But it really is a challenge sometimes to get that rope on the head. But often as a vet, it's one thing. I'll come out, somebody's been pulling on a calf for ages, couldn't get it out. I come out, put a head snare on it, bit of lubricant. Never underestimate the value of lube. It's great stuff. Plenty of lube on the head, deliver the head, and then apply your traction. And the traction, as I say, can be manual, just using handles. I'm too old for that now. I pretty much always put my calf pulley, or if I've got a jack handy, I'll use a jack, but I use it judiciously. I don't get too carried away, and I certainly don't use things like bikes and utes. And I knew a guy once who used to have a boat winch attached to the end of his bloody, calving pen, but he used to just simply winch the calves out using a boat winch. That's not appropriate. It's probably cruel. If you're doing significant damage, tearing them and all that sort of stuff, it just isn't right. And so you're better off to use less is more, use less traction, and get more help. Would be what I would recommend, rather than tearing the back ends out of cows and essentially destroying them. And here's someone with, they've got some straps on those legs and they're just easing that head out, providing that little bit of stretch. And as I say, in my perfect world, I'd have gloves on and I'd also be putting a bit of lube over the top of that head as well. So when we're pulling on the calf, we can pull the legs sort of together, or we can pull one leg ahead of the other. And sometimes we can even alternate the pull on the legs, so that if you pull one leg forward and then you pull the next leg forward, I'll show you a little picture here what I mean. If you pull them, they sort of, again, as I said, the head might bunch up and you broaden the shoulders. But if you pull one leg slightly forward, you actually can narrow the aperture of the calf. And so the calf becomes a little bit narrower, and that few millimeters can sometimes be all you need to just get that chest, the actual points of the shoulders to just sneak through the pelvis and come out of the cow. And pulling at a slight angle and often up and then down is the way to go. So by pulling down, you kind of create that diving motion that you're trying to get the calf to dive out. Second thing that I do is once I get the calf shoulders out, so I've got the calf sort of here, I then start to rotate the calf. And the reason why I want to rotate the calf, and you can see in the picture here up on the screen, is that we want to present the, the calf's pelvis at the most ideal angle to match up to the cow's pelvis. Because if you're trying to pull a square peg through a round hole, you're going to struggle. So we could prevent that hip lock where the hips get sort of jammed by rotating the calf. And if you ever come out and you find a cow that's down calving with a calf stuck half out of her, that's often all you need to do is just simply grab the calf and rotate the calf to try and see if you can encourage that pelvis to present at a more favorable angle to the cow's pelvis so that you can allow it to pass more easily. I think that's a really good trick, is putting that 45 to 90 degree rotation on the calf. And you do that, as you're pulling the calf out, the shoulders present, you start to rotate the calf, and the calf just rolls and dives out of the cow. It's really quite satisfying when that happens. This is the great question. When do you call the vet? And I say prolonged calving and you're unable to provide assistance yourself. And so that's where, if you don't have the skills to do it, you just best not to, screw it up by trying. If the cow's had a prolonged stage 1 labour, but you go in to check her to see what's going on and you can't find the legs or the head, like there's just nothing to feel. Especially if you go in and you can't get your hand into the birth canal. If she's been in labour for a couple of hours and you can't advance your hand up into the birth canal, there's a really high risk that cow's got a torsion. Occasionally you'll fire too early and we'll go out there and they'll say, no torsion, just the cervix isn't open yet. And then you go, damn. But more often than not, if you can't advance your arm, especially if as you go to put your arm in, you actually feel a twist, like you sort of follow in and think, oh my goodness, you follow that twist. If you feel that, that's call the vet for that one, because that's a torsion, may need a cesarean. If you have been working for 20 minutes and you've made no progress, so you're either pulling, trying to get a leg up, trying to get a head up, trying to do something, and you're making no progress for 20 minutes, the 20-minute rule tells me that you should stop and reassess. If you've stopped and reassessed and you've tried something different for 20 minutes and that still hasn't worked, and you've done this maybe a couple of times, or you've gone 20 minutes and you've said, wow, like there's no way this calf's coming out. You've got both feet, you've got the nose, but you can't even get them through the pelvis. Call the vets. Don't leave it until it's dark and you've been going 3 hours and the cow's down and the calf's dead, because at that point in time, it's just a complete and utter waste of my time and your money. And so that's why the 20-minute rule, I think, is a good rule. The disproportionately large calf where there's just no room is a good time to bail and get somebody else to make it their problem. And I always say that the best time to call the vet is if you've got a really obviously stinky dead calf, because nobody likes to do them themselves, and we hate doing them too, but we come out and do it. This 20-minute rule, I think, is really, really, really valuable. It's, some people stretch it to 30, and sometimes time flies when you're having fun. But the point that I'm making about this is that if you've been trying to do something for 20 minutes and you're making no progress, you've either got to reassess what you're doing, get some assistance from somebody who might be more experienced than you, or get the vet. They're the sort of the 3 options you have if you're making no progress. And the reason why I love it is because if you follow that rule, it tries to help that you never have that genuine disaster calving where, you end up with a dead cow, a dead calf, a distraught owner, a distraught vet. Everybody's unhappy with that outcome. If you're going and you're making no progress and you try something different, you make no progress, you can sometimes get to the scenario where you go, this isn't coming out, and you've got, 2 options really at that point, cesarean or euthanasia, and we do them in equal measure. If you've tried for hours and you've pulled until the calf's broken, all the bits are broken off, and the cow's down in the slop, in the crush, and you call us out and expect a good outcome from that, you're delusional. And so, from the point of view of animal welfare, it's awful. From the point of view of profitability, you're throwing good money after bad at that point, trying to get them fixed. And so there's no good result in just pulling calves for 3 hours until they're dry and everything's broken and the cow's down on the brink of dying. That's just a waste of your time, my time and your money. We talk about caring for the newborn calf, and the freshly calved cow. And this is kind of where I try and encourage people to position the calf on its chest with its legs forward and its elbows out. We clear the mucus from the nostrils and the mouth. We might pinch or tickle the nostrils. You can splash a bit of water. You can pinch them on the windpipe. You can rub them briskly with a towel. And we want them to stay warm, and sometimes simply warming them up to reduce that hypothermia will improve the outcome of the calf. And I've got a picture of a calf that's sort of sat up the way how you would normally like to see them sat up. And you can see by the way that calf's sitting that his elbows are out, its legs are up beside it, and that calf can expand both sides of its chest. So it's maximizing its ability to get oxygen in. And rather than having it laying on its side, where one side is congested and they're struggling to breathe, if you can sit them up, they'll do better. Back in the day, and I still remember this vividly, we'd swing them and we'd hang them from gates and all sorts of stuff. But if you think about it logically, hanging a calf briefly to get the liquid to come out, it's not coming out of its lungs, it's coming out of its stomach. That's the truth. There's very little fluid actually in the lungs of the calf. But if you hang them briefly for a few seconds, it's probably not the end of the world. But if you're leaving them hanging them over a gate, and I see people still do this all the time, you've got all the weight of the gut, the viscera, the rumen, the stomach, the liver, everything, all pushing down on their diaphragm and compressing their lungs, and they're trying to breathe like a goldfish out of a pond. And it just makes no sense physiologically to hang them on a fence. So try and avoid doing that. The other thing I've seen people do is swing them around at great speed. No, don't shake the baby. It's a terrible idea. Just sit them up on their elbows. If you've got some mechanical ventilation, you can. You can get these little calf resuscitators. You buy them, I think we sell them, but you can buy them from lots of places, that go on the nose, and it goes one way and it sucks the snot, and then you turn it around and it blows the air in, and they're kind of good. You've got to make sure you hold the esophagus closed, otherwise it just fills their stomach up with air. But that can be quite useful in some stage sometimes. I really, really, really like calf rugs. I think you've probably got the idea of that. I used to live in China, and it would be like minus 35 to minus 40 there. And if we didn't blow dry the calves after they were born to get them, dry, particularly their ears, all their ears would just simply shrivel up and fall off from frostbite. And so thank God we don't get that cold here. But if it's a cold, miserable, sort of central Victorian day and the wind's howling and it's been wet, it doesn't hurt to dry them off with towels and stuff like that. As I said earlier, make sure you disinfect the navels. We don't want them to get blood poisoning. We don't want them to get navel infections or joint infections. And do what you can to ensure that they get good colostrum. I encourage you to check calves for abnormalities at birth. I still see all sorts of things, cleft palates and all that sort of stuff in calves that are 3, 4, 5 days old. They're not compatible with life. Don't let the poor buggers suffer. If they've got a significant abnormality, they're better to be euthanized humanely and quickly, and make a record so that you know when that calf was born and who its mother was. And there's an example of a calf. This calf was days old with a clearly terrible cleft palate that's not going to be compatible with that reaching anything like a reasonable life. And so don't let them suffer. As I said earlier about labour, we've got to know what's normal before we can know what's abnormal. And so a normal calf, we want them to stabilise their body temperature around 38.5, 38.3, 38.8 within an hour of birth. If they're not stable, if they're getting colder than that, then they've probably got hypothermia and you need to be looking after them. They should have a strong, regular rhythm of their heart, 100 to 150 beats a minute. I normally consider 120 to be about typical. And when they're first born, they breathe quite fast. 50, one breath every second would be not unusual. They may be covered in the placenta, but they ideally are not brown or yellow, that real meconium staining, we call it, where, I sort of say to the farmers jokingly, oh, this calf's had a fright, it really scared the so-called shit out of it because it's nearly thought it was going to die in utero. If you've got that meconium staining, that does increase the risk of that calf developing some complications. So if you notice that, it's something to just put in the back of your mind, keep a close eye on that calf for signs of, respiratory infection, something like that. And we occasionally see the calves that have got the big swollen tongue. They might have been stuck their head out for a while. They might have a big swollen head. If that happens, but the tongue is not damaged, it's just really swollen, and that you do need to keep an eye on them because they often won't suck. They may well need stomach tubing and colostrum fed to them, so that they don't end up suffering, that failure of passive transfer where they don't get any antibodies from their mum. And so in their first 4 to 6 weeks of their life, they're incredibly susceptible to catching, any bug that's going around and will die. A calf should have pink, moist membranes. They shouldn't be dry or sticky. And the calf should respond to stimulation. If you pinch them, they should sort of pull their head away. If they're really flaccid, just laying there, sort of, then it could be that calf is acidotic. And if it's a valuable calf, it may be worth considering getting the vet out, and that we can give them some hypertonic bicarb to try and resuscitate those calves if they're really not responsive, but everything kind of was okay. When we've got our calves, we want them to take their first breath within 30 seconds. We want them to be lifting their head in 1 to 2 minutes. We want them to be trying to sit up within a couple of minutes and trying to stand within 15. They should be shivering within the hour and certainly trying to stand within the hour. And if we know that they're able to suck within 2 hours, then we're pretty happy that that calf has made a good transition to life. And knowing that normal behavior helps to identify abnormal behavior quickly. If you've got a calf that's 2 hours old and still laying there, not shivering, just laying on its side, staring into space at 2 hours old, that calf is in some problems, and you're going to need to do something to help it. So, basically, if they've got any symptoms like this, we want to basically either follow a good treatment protocol if you have one for management of these periparturient diseases in your sick cows or your calves, and or get advice early. Ring, get us out, do what you need to do, but they don't get a lot of second chances if you let them get too far down as babies. We want to, we've got a few posters that we can give people around, critical calf care: isolate, rehydrate, treat, protect, monitor, and support. And we have a down cow decision tree where if you've got a down cow, you want to decide, is she bright and alert, or is she dull and non-responsive? Because if she's bright and alert and is calved, she may have calving injury. She may have dislocated her hip. She may have, fractures. She may have milk fever. So, we need to identify, which protocol or which treatment we're likely to give. And at the end of everything, if we don't know what's going on, we should seek veterinary assistance. That doesn't necessarily mean we have to come out. It just might mean that you need to seek some advice from us to see whether you can, we can help. And that once you get to that point, if you've managed to get the cow through calving, you've got a healthy calf that's been born alive. That's when your journey is beginning for the next, breeding. Because, I often say to people, and we'll talk about it tomorrow night, that the next calving problem starts the day that this calf is born if you don't do things well. So having a good plan for your young stock management around their vaccines, their nutrition, weaning management, how we're going to benchmark their growth, and how we're going to manage their parasite burdens so that you've got a cow that produces a calf that grows to become the next generation of mums, is a really, really satisfying and valuable part of what we do. And, also getting that assistance early so that the cows will successfully rebreed to stay in your herd as a productive member is a pretty cool part of the equation. And I've managed to finish pretty much right on time. So I'm pretty pleased with myself. I had to rush a bit there at the end.
No,
I apologize.
that was awesome information. I'm sure everyone's going to get something, from that. That was awesome. So we've got about 15 minutes of questions. So just send them through to me, and I'll try to get through as many as we can in the 15 minutes we got left. So we got one here. So when the water bag breaks in labor, is the calf able to breathe, and does it affect how long they should be left in labor?
Well, that's a great question. Once the water bag breaks, I've actually had calves inside the cow bellowing, inside the cow. So clearly they are able to expand their lungs. Is it ideal? Probably not, because there's still a lot of fluid in there, and so they can aspirate. Essentially, while ever the placenta is attached and the calf is getting oxygenated blood through that placenta, that's okay. So we will see cows that the water bag breaks and the calves will live 10, 12 hours providing the placenta remains attached. Generally speaking, though, if the calf is in there and sort of breathing and bellowing inside the cow, you need to get that calf out sooner than later. So if they're not, assuming they're not, which most wouldn't be, you would just if the water bags burst and the calf is still alive inside the cow and things are progressing the way we would expect them to progress, then that's I've got no problem with that. As they move into move through stage two labour, and you've got sort of feet and nose, then wrists and bridge of the nose, and then elbows and ears, and then the calf's head is presented. I've actually seen calves at that stage where they're obviously their umbilical cord is being compressed because they're fully engaged in the birth canal, and I've seen calves at that stage sort of head out sort of to here, take still 20 minutes or more to be delivered, breathing happily, still connected to the cow. And yet I've also always believed that breech calves are a different story. Calves coming backwards, the umbilicus seems to fail on them much more quickly. This is only my opinion. That calves coming backwards, you get a lot less time to sort of, I suppose, play around with those. You really, if it's coming backwards and you've got that out past the hocks and you've got the ability to pull that calf out, I probably would assist that one sooner than later, especially if the calf is showing signs of distress. And often the way you'll tell the calf is distressed, apart from the meconium, which is like the feces that they pass, that's one very obvious way. But you'll often see calves that they're doing big, jerky, twisty movements. And you'll see the calf sort of inside the cows and the legs are really jerking around. That calf is starting to become compromised. We don't have fetal monitors like they do in people where we measure heart rates and stuff like that. But I generally assume that if a calf is being delivered, it's in stage two labour, things look like they're going okay, but the calf starts to show signs of distress or the mum starts to show signs of distress. I'll often assist them relatively earlier than I otherwise would have if they weren't. But that's a really good question. About whether they can still breathe in utero. The answer is yes, but it's not ideal.
Perfect. We got one here. So when you're pulling calves, is it okay to go against the natural contractions, or should you always pull with?
Yeah, another great question. Ideally, you work with the cow. Like if she's contracting and you're pulling at the same time as she's contracting, if you're using a pulley, you sort of as she contracts, you can jack the strain up and then push down with the contraction. Or if you're using a pulley, you pull the rope up tight. I lock mine in, and then as she strains, I'll push down on the rope, or I'll rest on under my armpit, or sit my bum on the rope, put some weight on that just to work with that contraction. There's exceptions to that rule where I don't work with the cow. I just want the calf out, and that is where you do things like the cow suddenly sits. That's really frustrating when that happens, where everything's going along really smoothly. You think that it's going great, and then she just decides she's going to flop down. And at that point in time, I usually will just pull the calf, not worrying about whether she's contracting or not contracting. I just want that calf out. Putting it crudely, like say we skull drag him out. We literally just reef that calf out. But most of the time, I would rather people work with the contractions if they can.
There's a question here that is, yeah, quite interesting actually. So they have their cows, like they're calving cows in a paddock, which is close to a shed with a crush in it.
Yep.
When they see their cow is calving, is it okay to chase them up kind of about 100 meters and put them in a shed? Or so like kind of bit about movement. If they're going into labor, is it good to kind of move them around?
That's a really good question. So I work a lot in the dairy industry, and in the dairy industry, that's actually quite common for cows to be moved like at the start of stage one labour. So they're just starting to think about labouring, and we move them somewhere where we can supervise them more closely. The risk in that is that you can interrupt them and they can stop their labour, and so it depends. I mean, I always say the answer depends. It depends. If you worked well with those animals and they're quiet and they're comfortable and you can move them quietly, conveniently into the thing without raising their stress levels too high, and you don't make it a really anxiety inducing thing to do, absolutely you can move them into a calving shed. And as I said, quite typical to be done in dairy practice. For our beef cows that are possibly not as commonly handled, and so they're a bit more likely to be stirred up by being one, put on their own and isolated, and two, just simply the fact that we've got to get in and chase them around to get them, where we want them to be. If that's, it can become counterproductive. So one of the things that I talk about tomorrow night around some of the management stuff that we can do that reduces the impact of calving, particularly for our beef cows, it's often just simply getting them comfortable with us moving around them, with us being in their paddock. Even if it's driving through in a side by side or a 4x4, just so that you can just move through the cows without them becoming unduly anxious. And that's where often feeding them in that few weeks leading up to calving becomes a part of that and allows you to observe, and if you need to assist. The idea of moving them to a calving shed is a great idea, especially where we're talking cold, windy, wet, awful weather. Your calving shed environment is probably going to be cleaner and drier. And so, if you're able to get them there without basically stopping their labor, because adrenaline is like the antidote to labor. If you really stir them up and make them really anxious and fired up, then that will stop their labor. And by stopping the labor, you can increase the risk of calving, mortality. And so, it would be entirely dependent on your stockmanship, how well sort of I suppose humanized your cows are and how well they respond to that, and then as I say, the facility and whether if you've got to chase them around a paddock to get them in is different to if you've opened a gate, they walk out, they go up a laneway, they walk into a shed, you shut the gate on them, and it's all peace and quiet. Does that make sense? Like what I'm getting at there?
Yeah, definitely think so. We have that on our farm. It's always, yeah, we've got the crush in the paddock, so you do have to shift them a little bit. So can definitely understand that. So we've got a question about some birth defects. So like a cleft palate and like stuff like that. Is it normally entirely genetic, or can it be caused by like the lead up, like the development of the fetus? And if they do have a calf with genetic issues, should you like cull that cow or just keep an eye on it?
Yeah, that's another really good question, a really hard one to answer because most developmental defects are not necessarily genetic in that they are often heritable, but it requires the mating to match up. And so, it can just simply be that you've been unlucky and combined two that have got the same genetics. You could rebreed that cow to a different bull next year and get a totally different outcome. A lot of the defects, though, that occur are developmental, not genetic, and I often can't tell you the difference between them. We see things like the inside out calf. Most people will have heard of them or potentially seen them. They're called schistosomus reflexus, where the gut doesn't close. It's all the guts are on the outside and the calves are born inside out. Now, I've had cows that we've done cesareans on, done that. Cows got pregnant, delivered a perfectly healthy, normal calf the next time. And so is it genetic? Probably not. It's probably developmental. Do we know what all of those factors are that create those issues? I'm sure that I don't. There might be smarter people than me that do. but I would say that a cow that has a calf with a cleft pallida, I had them with meningioma where like their brains on the outside, cyclopia, all sorts of weird stuff. Um, I tend not to cull them based on that. But if they had a second one, then absolutely they would be culled. Like, you know what I mean? Like, because it's often hard to distinguish the difference between developmental and genetic. And we don't do enough diagnostics because, frankly, there's just not the funding to do it. If you were a breed of cattle that had a known genetic defect and your animals were either genomically tested to say that they were carriers of that defect and you had a carrier mating that caused the defect, then obviously it's genetic. But other than that, it's very, very difficult often for us to determine what's come down that path. Um, Now with the genomics, we're actually able to use that knowledge to avoid certain matings to reduce the risk of both carriers and overt clinically affected animals. And I love genomics for that reason. I also love genomics because the days where bulls would get into AI programs that had huge calves is almost in the past. I hardly ever see, most bulls that are really low or really high calving difficulty bulls. So, not good calving these bulls. They just don't make bull teams anymore. And so use our genetic tools that we have available to us. And if you were to get a run of defects on a particular farm, then it probably is worth contacting your vet and seeing if they can get some, an SDI, a significant disease investigation, see if we can identify whether there is a genetic component to it. Because I'm sure there's a lot more stuff goes on than we're actually ever able to identify, just simply because there's not the resources to do the testing, and a lot of the time, you do feel that you're throwing good money after bad. So it's a terrible answer to the question. I can't answer it basically, but yeah, that's where we're at.
Yeah, that's a tricky one. Well, I think we might nearly wrap it up there. Yeah, so tomorrow I'd like to thank Rob firstly for his presentation. That was awesome info and yeah, a lot of questions. So sorry we didn't get to go through all of them, but tune in tomorrow and yeah, we'll answer questions again. And yeah, thanks Rob for an awesome presentation. So tune in at the same time, everyone, tomorrow night using the same link. And I'll quickly just share my screen. We got a bit of a survey, so if you could just scan that with your phone um, and then fill in the questions. It's relevant only to the part one. There's a part two question as well, so just do the part one. But yeah, thanks everyone, and thanks Rob, and yeah, looking forward to seeing everyone tomorrow night. All
My
right,
pleasure.
thank you.